Very warm welcome to one and all. Welcome to the today's opening session of the Ayush Vignan Sammelan webinar series. And so today we have Dr. Tamilarasan sir, Assistant Professor from Department of Shalya Tantra from Sairam Ayurvedic Medical College and Research Center, Chennai, Tamilnadu. So, sir will be engaging with the topic clinical utility of Anuśastra Karma, reassessing parasurgical techniques in modern day practice. Now, moving on to the small introduction regarding sir. So, sir has been graduated from Sairam Ayurveda Medical College and Research Center, Chennai, and postgraduated from Ayurveda Mahavidyalaya College and Hospital, Hubli, in the Department of Shalya Tantra. And sir has also academic experience from exposure and practical classes from final year undergraduate students also conducting theory and practical classes. And sir has also attended many seminars, workshops, and also presented papers in many conferences. And sir also published two UGC care articles also. And sir also conducted health camps in cyclone relief health camps. So we welcome you, sir. We welcome all the participants also. So over to you, sir.
Thank you, ma'am. Thank you very much. Gurubhyo Namaha. Very good evening to all. First of all, I would like to thank the organizing committee for inviting me for this webinar series and congratulate him and the team, All India Homeopathic Student and the Youth Association AIHSAYA, for conducting that webinar series in continuous and holistic manner. And first of all, we will see that today's topic is clinical utility of Anuśastra Karma, reassessing parasurgical techniques in modern day practice. Means, and another one thing is I seen here. This is all of the participants or students are from, most of them from homeopathy stream, and then this is one of the novel approach from the team, calling the another fraternity for giving that session. So this is also this is why I told, like, this is a holistic manner they are continuously they are conducting the webinar series, right? Then first we will go to the topic. So first of all, we will see the what is Ayurveda. Ayurveda deals with the physical, psychological as well as spiritual well-being of an individual. In that, from the ancient times only, it is Ayurveda is divided into 8 branches. That is not only divided nowadays. In the ancient time only we divided. It is mentioned as 8 branches. One is Kaya Chikitsa, and another one is Shalya Tantra, Agata Tantra, Shalya Tantra, Kaumara Vritya, Bhuta Vidya, Rasayana, and Vajikarana. In that, especially, I will more concentrate on that Shalya Tantra. Means that is the branch which deals with the surgical and parasurgical procedures, and even though other diseases also, but mostly we will branch deals with the surgical parasurgical approaches. That one of the main and foremost thing which is explained is Shastra Karma, that is surgical procedures, and along with that Anushastra Karma procedures also explained in efficient and important way. Why? Because all the diseases which is require surgical approaches are not treated with only the surgical. We can also use the Anushastra Karma, that is parasurgical process also, which will be giving very effective relief to that patient. So that only in Ayurveda we concentrate more on parasurgical processes also. First, what is Ayurveda and surgery? Means in that we can ask about. First of all, people will ask me, means in Ayurveda surgeries are there or what? Because they are not, people are not aware of surgeries or not part of our studies. So that for that we will proudly say like our Acharya Shushruta is the father of the surgery and father of plastic surgery. And even though now modern people also accepting that our Shushruta is only the father of surgery. Because why? Because all the surgical process which they are following from the following and they are repeatedly practicing nowadays, that is based on the Sushruta's concept of surgeries only. I will tell it in the next slide why and how they are practicing it. And he was a considerable medical knowledge of relevance even today. It indicates that the India was far ahead of the rest of the world in medical knowledge. Means, but nowadays that due to the modernization and developmental thing, so considerably, Sushruta is the father of surgery. Then Sushruta, where means what is the reference? We will always we will ask about the reference where it is. How we were telling like Sushruta is the father of surgery. In the olden periods only, the Sushruta Samhita, which is written by Sushruta. So it specialties like already said, medicine, pediatrics, geriatrics, disease of ear, nose, and ENT, toxicology, and that ophthalmic and psychiatry also mentioned by the Sruta Samhita. In the 121 different types of instruments are mentioned. That is all. That is only till now we are practicing the same, but in that modified ways. But olden days there are not much instrumentation was not there. They will be using that in their own ways, and that shapes are of the instruments are resemble like how the birds nose and how the animals nose, like that only they classify. Now we are using in the modernized way. And in that Sushu Samhita, it is mentioned as 300 surgical procedures and classifies human surgery in 8 categories. That is categories of surgery. Like we are doing excision, incision, and scraping procedure, and we are doing puncturing. That basically means that not the procedure means complete procedure. They are what are the basic basic procedures. They are classified into 8 types. And then in Sushu Samhita, it involves 650 drugs of animal, plant, and mineral origin also. Then coming to the Anuśastra Karma, that is parasurgical procedures. Acharya Sushruta described the concept of Anuśastra Karma as important modality of Shalya Tantra. Why? Because Acharya Sushruta, even though they are considering as a father of surgery, so Acharya Sushruta will consider as a we need to avoid the surgery. Means that is the concept. Why? Because for every disease, ultimate means last option is only the surgery. First, we need to try it with the medicine, and then we need to try it with the parasurgical procedures. Then we can go for if it is also not giving good result or it is not treating completely, then we can go for the surgical management. Like that only Shushruta classifies. So that only we are also following the same thing which we are practicing in the day-to-day life. Why? Because patient will be coming to our OPDs or hospital. They will be asking for that means they will be having multiple opinions about so they came to our OPDs with the for non-surgical manner. For up to some extent, we will be managing with that so non-surgical like parasurgical procedures, and we can give internal medications also. But in some extent, we need to go for surgical only. I'm not uh, opposing that we should not do surgery like that, or we should not go for modern practice. At some extent, we can try it with our limitations. We can try it with our parasurgical methods itself. So that is parasurgical means what is the difference? I will explain about that. What is surgical and parasurgical? Surgical means we will be using the sharp instruments and for the procedures, and without sharp instruments, without any major extensive opening, we will create. We will do the procedure that is with the help of the Anushastra Krama, that is surgical procedures. So in that, a lot of things are explained. I will be here dealing with the only 3 things. One is Agni Karma, and Shara Karma, and Jalukavasana. Agni Karma, that is we can more or less we can correlate with the thermal cauterization, and Shara Karma, that is caustic alkali with the help of caustic alkali chemical cauterization. And another third one is of Jalukavasana, that is one type of Rakta Moksha, means bloodletting therapy, that is leech therapy. So that we can discuss in that first one. That has Agni Karma, that is thermal cauterization. Agni Karma means that name itself indicates Agni and Karma. Agni means we can all will know about, that is fire, and karma means the procedure. So with the help of Agni, we are doing the procedure, that is Agni karma. So in that heat is directly or indirectly applied to the affected point by using the different materials. Like we can use that. I will show you the next slide. So shalaka means made up of panchaloham, means with the makeup of 5 metals or single metal also, even from the gold, silver, or stainless steel, or copper. Like that, we will make it with, and we will heat it, and we will keep it over that area. So that is one type of one type that is called as Agni Karma. In this thermal energy is transferring into our body, and it will give some relief to the patient. So what all the, in what are all the condition we will do Agni Karma means, we will, whatever you are using that now the cauterization, so we are removing that exam simple warts, and in OT cases, in surgical cases, we will be using for clotting, arrest the bleeding, or cutting the tissues, or what we are using in the multiple ways. The same comes under thermal cauterization. So here we will be using in the, mainly we will be using in the pain management and accessing the some tissue extra growth, like, in whatever I told previously, war conditions, and in skin tag conditions, and in cases of excision of corn, like that in condition we will be using. And in case of some external hemorrhoid, I mean external skin tests, not hemorrhoid, external skin tests, we will be using for removing that skin tag. And in case of in case of, mostly in case of pain management, so yeah, all kinds of pain, exclusively for musculoskeletal conditions, like in case of spondylosis, or in case of any small spasm, like in that condition, muscle spasm condition, we will be using it in many cases. And in case of, in some case of hernia also, means in non-complicated undisturbed hernia also, we will be using it. Is a potent and minimally invasive parasurgical process which has wide application in chronic conditions as well as in emergency management. Why here is emergency management? Patient will be coming in that pain only, most of the time. For whatever the medications or whatever the treatment we are giving, ultimately patient needs that relief only, means withdrawal of pain. So, so that only I mentioned as a emergency management, not in the case of road traffic accident. I'm not telling about that. So patient will be coming in that OPD, and immediately we will do that process, and we will give the relief to the patient. That is emergency management. So what is about the definition of pain? Is an unpleasant sensory and emotional experience which is generally associated with actual or potential tissue damage. In such conditions, Agni Karma give good relief by increasing metabolism, increasing blood circulation, decreasing pain perception, and relaxation to work. I'll explain in that next slide. So here, generally, first we need to about think about how the pain is uh, perceived. So first we will, any pain signal for pain, it is sending the signals to the afferent nerves by to the brain. So here Agni Karma will stop that signal by block the first block the signal, and it will increase the blood flow, and it will relax the muscles and reduce the stiffness, and it will promote the healing by increasing the blood flow. That is only that is the way how the Agni Karma is acting in this. So this is why this is Agni Karma in pain management. The first image shows that low back ache. Patient is came with that pain in the low back region, and we are doing with that Agni Karma. As I mentioned earlier, that shalaka is made with that panchaloha, means with the different fine metals, including the silver, gold, and copper, and steel, and along with that tin. So with the 5 metals and ratio we made, and we will be heating at the heating up to red hot, and we will touch and take. So the, like that only we can see that in the second image that points are marked. So like that only we will be mark the most where that most tenderness point we will be marking, and after that we will do, and we will be applying the any soothing cream, like we will be generally we will be using aloe vera. Aloe vera we will apply, and it will immediately pain will be the burning sensation will be cut off. So like that only we will be doing it in the consecutive sittings with a span of 3 days, 5 days, 7 days, depending on the condition we will be using. The second image shows us in case of osteoarthritis, patient is complaining in the pain in the knee joint. So we are doing in that. And third image also shows that in the low back region only. So patient is having some lumbar compression. So we are, along with that internal medication, we are doing this one. So I'm not telling like only this procedure will help in that complete recovery of the disease. Only it will give the immediate relief to the patient, and along with that we need to give the internal medications and other treatments also, panchakarma treatment also we will be doing. So with this holistic approach, the patient will get cured at earliest manner. So the second type is Agni Karma means Snayudavata. It's nothing but we can correlate with the tennis elbow or golfer's elbow. So if it is a lateral epicondyle of the region, lateral epicondyle region, so we are doing the same Agni Karma, but it in a different way. Here there is no scar mark. There is and that therapeutic effect are also very much good. That whichever the shalaka, whichever the metal we are using here is only the silver, means complete silver, not that not any mixer of. So here we are heating the one tip, and the heat is transferred to the another tip, and the therapeutic effect will therapeutic heat will transfer to the tissues, and it will give relief to the patient. So like that only, because it is a non-invasive, completely non-invasive, and it will give much good result to the patient. So another one cases of in case of frozen shoulder. So here a patient came with the unable to lift the hand. So after that we examined, and we marked the points and insertions also. And after the marking, we did the Agni Karma. Patient is able to completely able to lift the hands. Then for next, this is another one interesting case of we did the Agni Karma in the first. I will show the video. Here the patient is see the tremors, essential tremors we are seeing in this case. So much unable to hold that bottle in an efficient way. After the marking that areas, and we did the same Agni Karma, and after that, this is a post procedure video. So here that hello, here that here that complete not complete relief, partial relief patient immediately after doing that procedure, patient got the partial relief, and in the next thing patient will get much good relief from the patient. So this is another one case of plantar fasciitis. In this also we did. And remember that is a patient is having a chronic long chronic condition, and so we did it in that a little deeper way. So in this condition also patient able to walk immediately without any pain. So how the Agni Karma is acting? Probable mode of action is the pain receptors in the skin, means skin and other tissues are all having free nerve endings, and due to the hot shalaka, means whichever the metal we are using, there is restriction of free nerve endings, and it causes closing the gate and prevent the sensory transmission of pain. That is a gate control theory. So after applying the heat, all the free nerve endings are getting blocked, so distracted, and then it is it will there only it is a cut off the pain signal to the brain. So after that what happening, so lot of blood circulation, blood pooling was there coming there, and the wound healing is getting happen, so that completely pain relief is attained. The another one theory is Agni Karma may stimulate the sensory receptor lying in the muscle by sending the message to the brain. It will stimulate the pituitary gland and to release the endorphin. So it will act as turn into bind with the opiates and receptors and in the pain cells to block the pain stimulate. So like this also we can act. We can say it as a how it is acting in our body. So then second one, coming to the second procedure, that is Rakta Mokshana. Means Rakta Mokshana means nothing but blood letting. So from the body we are letting it out. Some of the blood depend on the conditions. So uh, that is why it is named as a blood letting. That is Rakta Mokshanam. So here lot of types are there. One is Jaluka Vacharam, that is leech therapy. Then second one is Siravedharam, that is you can call it as a venous section. Then third one is of prachanam, means we can tell as a micro needling. We can consider as a micro needling. Then another few types are there. We can consider as a we can correlate with the cupping therapy, that is alabu and shrinker. With the help of bottle guard, we will be using a we will be letting out the blood. That is the olden days. Now we are using it in the modern, means we can modify it into a cupping. We can take it as. So another one thing in this Lord Dhanvantri, in his hands also one hand he will be keeping, he will be taking the Jaluka, so that so that we can assume that how important the Jaluka is. So here Jaluka means here we will be using leech therapy. In the case of Dustar, we can take it as a non-healing ulcer. So the patient came with that already 2 times debridement done, but even though healing is not properly, again getting infected. So patient came to us and we did it Jaluka Acharna continuously with the span of 5 days, and after 3 months it completely cured. That is the fourth, means the fourth image we will can see that one. So this is an how it will be acting, we will see in the next slide. So another one case, in that case of uh, thrombus hemorrhoids, sorry, thrombus hemorrhoid. So this is in that one case also we can get in thrombus hemorrhoid, the clotted blood will be there inside that swelling. So by applying that Zaluka in that thrombosis, so it will suck the whatever the collected tissue, whatever the collected blood, so that will be sucked by the leech, and it will be the swelling will be reducing gradually. So if this we can do it in the single setting, or we can do it in the multiple settings also. So in the second case, it will be in the varicose veins. It will very much excellent result in the case of varicose veins. Because of varicose veins, we are giving internal medications, or the patient is having the sedentary lifestyles, or whatever the pressure over that area, but it will in-cause veins will be there. But whatever the stockings or whatever the treatment modalities we are doing also, this will give excellent result. Why? Because it is having that bioactive peptide, bioactive enzymes in the leech saliva. So it will be very much excellent in the treating the condition of varicose vein. So another one important, and we did in that cases, case of graft rejections. This is a case of this one after grafting, skin grafting. So in the case of graft rejection, we can see that changes in the blackish discoloration over the edges of the graft. So in that conditions, so it is so that only it is called as a micro doctors, or like that leeches are. Because why? Because in the capillaries, it will not, it will started this one falling. So that one, so that we applied leech over there, so it will start that sucking that it will give the enzyme hirudin, and it will changes that. So this is how the OT setup only we did in the post operative, in the post operative ward only we did this thing. So why in the emergency condition we will do this one in the OT, means post operative ICU wards also. You can see that how it is getting the blood from that area. So it will means it will give the, means it will bioactive enzymes will be going inside, and it will start sucking the blood over the, means pool blood over the area. So how it is acting? So it the leech is applied to the biological active areas of the human body. The bite itself gives a positive effect. Leech saliva contains hirudin hyaluronase enzyme, which acts as a anticoagulant, local anesthetic, anti-inflammatory, vasodilator, antithrombotic, and hypertensive and hypotensive and analgesic effect. So this because of this way it is acting over that condition. Then second one is of venous section. So this is another one. If it is on previously I told about Talukosana in varicose vein. Here in case of in severe extensive condition, we can go with the venous section procedure. So here we are collecting the blood from that lower limb, means where that veins are enclosed. So we are reducing the pressure over there, and to be very much effective yeah, in that pumping the blood. We are collecting the pool blood over there, and it will be we are reducing the burden to the veins, so that only it is effectively working in that condition. Next one is of Raktam, that is one type of Prachanakara, that is micro needling. So in case of alopecia or alopecia areata in patchy hair loss, we can use this kind of bloodletting procedure. So here what we are doing with the help of lancet or micro needle, we are pricking in the multiple places where we need to do the where we are need to do the bloodletting. So we are mark the areas and we will be doing it with the equidistance and with equal pressure and equal intensity. So it will pooled blood will be coming out, and after that we will be applying the medications which is needed for that condition. Here we are using that mush, we can call it as a mushy, that is carbonated powder, means carbon powder. So carbonized powder. So we can apply in nanoparticles will be there. So it will be getting into that punctured area, and it will start acting. So this is one type of Raktamokshanam, that is bloodletting. Then another one is cupping therapy. So all must hear about that cupping therapy. So in this also two types are there. One is dry cupping therapy and wet cupping therapy. So dry is a first image. We can only we are creating the negative pressure over that area. So because of the negative pressure, that skin and the underlying tissues will be coming inside, and it will relaxes that area. So in that wet cupping, after negative pressure, after creating negative pressure, after some time we will release the pressure and we will give some pricks over that area. So after that again we will create a negative pressure in that area. So and it will start oozing, blood will be starting oozing. So it will be very much efficient way in the cases of spinal cases and small detox. We can correlate as a means we can modernly we can correlate as a detoxification. So probable mode of action is detoxification, the removal of stagnant or toxic elements that accumulates due to the poor digestion, unhealthy lifestyle, and stress. Helps to cleanse the system and improve and it will improve the circulation by enhance the blood flow to that area, and increasing the blood flow. It will also increases the oxygen and nutrition to the tissues, and it will promoting the formation of fresh healthy blood over that area. And it's mostly in the cases of non-healing ulcers, varicose veins, and diabetic also it will be helpful. And it is having anti-inflammatory analgesic. The removal of inflammatory mediators in the localized blood alleviates pain and swelling in the conditions like arthritis and gout. In case of leech therapy, we will be doing leech saliva contains bioactive substances, they like hirudin, destabilize, and anesthetic. They are having anticoagulant, thrombolytic, and anti-inflammatory effect. And by this, it will boost the immune system also. By removing the toxins, it will boost the immune systems. Third one is of Sharakarma, that is caustic alkali. That is one type of Anuśastra karma, parasurgical processes mentioned by the Acharya Sushruta. Here, where we will be means how we will prepare, we will see in the next slide. Here, where we will be using means in that hypergranulated tissue or elevated margin, that wound, and heart, where we are having the hard consistency in the wound, and where we are chronic wounds, and in case of unhealthy wounds we can use this Sharakarma. And in case of internal hemorrhoids, in the third degree of internal hemorrhoids also we will be using this one. And in case of rectal prolapse also we are using in the regular day-to-day practice. So how we will prepare means that we will be using the drug called Acaranthus aspera, that we will take it as in the bunch, whole bunch, 10 nearly 10. How generally we will take it as a 10 kgs, and if after burning into ash it will comes around 1 kg. Along with that we can add 6 parts of water, and after that we will kept it as a whole night, and after that we need to filter that liquid in that for 21 times with the cloth, and after that we need to boil continuously, and then it will be up to the thick consistency, not that liquid and not that hard consistency. In the paste consistency we will take it out, and we can add some more potent drugs also, that is we can grade as a mrudu madhyam and tikshna ksharam, means according to the mild, moderate, and severity of the pH. If Alkali means it always above 7, and it will be up to 12 also we will be using, but mostly we will be using around 10. So that is here. So this is where how it will be in hemorrhoids. This is the case of internal hemorrhoids. We are applying showing only the hemorrhoids, and we are packing that beside that area only. We are focusing the hemorrhoidal mass only. In the second image we are applying the alkali which we prepared. So then third image, after waiting for, we need to wait for 100 seconds, and then after immediately it will turns into black. So how that pinkish red turns into black by after applying, immediately after applying chara. This is how it is act in the cases. So in case of non-healing ulcers, we applied the same sharam in the case. So in not in all cases we need to we can apply shara. So only in certain cases where we already mentioned, like where it is elevated or more granulous, in that conditions only we can apply. So in that condition we in the same case we got this result. How it is acting? So the chemical cauterization, the corrosive nature of the alkali cauterize the targeted mass hemorrhoid, and then protein coagulation. The application of Shara, it will be directly, it will be acting on the coagulation of protein, and it will affect the tissue and local blood vessels. So this leads to the permanent obliteration of the blood supply, like in hemorrhoid. It will be getting fibrous, necrotic, and eventually slough off within a few days. In generally, in case of internal hemorrhage, we will be applying in the first day. After 7 days, within 7 days, fifth day to seventh day, it will completely slough off. So that is with there will be the zero mass in that region. So that is anti-infective action. Anti-infective means because of the drug we are using in that Shara, it is having the anti-infective properties also. Then coming to the conclusion, parasurgical procedures like Sharakarma, Agnikarma, Raktamokshana have proven effective and stood still in test of time against various modern surgical procedures. These procedures are cost effective, convenient with reduced hospital stay. So because why? Because patient ultimately we need to treat the patient. If whatever the patient we are admit the patient, we will be doing continuous treatments, but a patient is not getting relief means the patient will not be happy. So ultimately, this in these processes, we will be getting good results in that OPD basis itself. We can call the patient the week, depend on the condition. We can call them weekly or 5 days once or 15 days once, depend on the condition. We can call them and we can do the procedure. So in some cases, we can do it the magic in the first sitting itself. So patient will be happy because the pain is whatever the explain the pain. So that is in the um, in psychologically patient may get affected by this condition. And even though if in case of some surgical cases, if you're telling like we need to surgery immediately, in that itself patient will be going into shock, means and psychologically it will affect the patient. So in such conditions we can go with this, means in case of hemorrhoids and anatomical conditions, we will be going with this parasurgical methods, like what we are telling. In case of internal hemorrhoids we can go for sharakarma. In case of external sentinel tag, we can go for Agni Karma. We can directly we can with the help of cautery we can remove the skin tag. So like that we can use this parasurgical methods wisely. The it will be very much effective in cases of treating the patient with minimal OPD. Need not to go for hospitalization and need not to go for uh, longer duration of treatment. So with this, I will conclude my session. Thank you. Another one thing is in the book for the source book for plastic surgery. In that we can see that they are praising that Sushruta effort in doing that plastic surgery. Why? Because why Sushruta considers the plastic surgery means he did it in that olden period itself. He did plastic surgery, transplantation surgeries, so that only that evidences are there, so that only the plastic surgeons are who are all the surgeons are accepted widely as a father of surgery. Thank you.
Thank you, sir. Thank you so much for the wonderful session. And so we have a small doubts also, sir. Can we have the doubts session, sir? Question and
Yes,
answer
yes.
session. Respected participants, if you have any doubts, you can ask the questions. Yes. Sir, actually myself have a question. Can I put forward, sir?
Yes, 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 complete.
Yes, sir. Actually, can you broadly explain regarding the leech therapy, sir, which you have told in some cases of chronic and in some cases of ulcer, the leaching therapy has been used actually. So, could you please explain in a broader way, sir, if you don't mind?
Yes.
Mm.
Actually,
Actually,
mm, my voice is
my voice is
hello. Mm.
Yes,
Actually,
sir.
ma'am,
actually, ma'am,
uh,
uh,
in case
in
of
case of
chronic
chronic,
wound cases, we will be using this Zolocozana because in wound is that in normal patients, in normal cases, not like varicose ulcers or not like diabetic wound ulcers, diabetic ulcers. Other cases we can treat it with normal applications like any ointments or any internal medications we can treat. But in cases of we can in case of diabetic wound, diabetic ulcers or in case of varicose ulcers, because that in that conditions the veins are compromised, means the microcirculations will be compromised in that area. So it will, by doing leech therapy, it will improve the circulation over there. Microcirculation will be improvised, so that only it will giving much result over there. So it is not needed in the all types of wound. Only in case of where that where there are circulation is compromised, and wound needs complete three things. One, we need to keep it clean, and another one thing, we need to keep it healthy by um, do by giving a proper circulation, by proper circulation, and another one thing is proper nutrition, circulation, and proper nerve no ending. So another one thing is, third one is of by nutrition, proper intake of food. So these three things will be need of wound healing. So in that case, if it is any nerve damage or any in cases of any microcirculation is hampered, in that condition we can go for leech therapy. So by after applying leech therapy, what it will happen means, it will not only sucking the blood. So in this we need to very much clear. So here leech is sucking the blood, and also it will gives that compound, means whatever I explained in that slide. So it is having the hirudin compound that is very much effective in studies are still going on. So how, what are all the components is leech is having. So in that mostly in all species of all the species of leech, uh, hirudin compound is majorly present in that. So hirudin is having the anticoagulant and anti what are the explain. So in because of that, it is having the because of anticoagulant, it is not clotting over there. So what are all the what are all the clotted blood, or what are all the microcapillaries, it is the blockage is there, it will release that one. So because of that, it will it is acting in that chronic ulcers, or in case of mostly in case of varicose ulcers, or in case of diabetic ulcers.
Yes, sir. Uh, yes, sir. Thank you so much, sir. Sir, is there any limit for the sitting, sir? Like how many times we can have to do such things, or is there any dependency of the time period, sir?
Not
not
depend on
depend on
depend on the
the
condition, ma'am.
condition.
Acha, okay, okay. Uh-huh.
Because patient is
Because
having
patient is having
in that
in that
condition,
condition,
we did
we
it for
did it for
3 months,
3 months,
literally,
literally,
with a camp
with a
of
cap of
1 week,
one
10
week,
days.
10 days.
Hmm.
But in
But
case
in
of in
case of
small in smaller
in smaller
ulcers, we can
ulcers,
go
we can go
with the
with the
things
two
is enough.
things is enough.
Other,
Other,
along with that,
along with that,
we can do the
can do
same
the same
other
other
medications
medications
internally, and
internally, and
external
external
applications or
applications or
external
external
cleaning, and we
cleaning,
are
and
doing
we are
whatever
doing
the things
whatever
we are
the
doing, that
we
is
are
we
doing,
will
that
do
is we will do
regularly.
regularly.
But
But
along with that, we
along with that,
will
we
do
will do
weekly once.
weekly one.
Acha, acha. Oh, thank you, sir. Thank you so much for the clearance.
Thank you.
Thank you, sir. Uh, is there any participant like they want to ask the question? They are welcome. Sure, sir. I hope they have left with the knowledge actually. Thank you, sir. Thank you so much for the today's session. Actually, hello.
Thank you, ma'am.
Thank you, sir. Uh, like really, it's a wonderful session, and we have learned some of the different techniques and different surgical procedure also along with that. And thank you all the participants also. And we'll be right back with the tomorrow session. One more session from the Unani Medicine, Unani's team of medicine. Thank you all. Thank you, sir. Thank
Thank
you,
you.
everyone. Thank you, sir.
Thank
Yes.